Deep breath in, filling yourself with calm awareness. Release it gently, allowing any tension to dissolve. Today we're going to talk about something that affects so many people, yet often goes unrecognized. Over-cleansing, and how to stop this cycle that may be undermining your skin's health. In our culture, cleanliness is deeply valued. We're taught that clean is good, that more cleaning is better, that squeaky clean skin is the goal. But when it comes to your face, this mentality can actually damage your skin. Over-cleansing is one of the most common skincare mistakes, and it creates a cascade of problems that people then try to fix with more products, more treatments, more intervention, never realizing that the cleansing itself is the root issue. Let's begin by understanding what over-cleansing means and how it damages your skin. Over-cleansing happens when you cleanse too frequently, too aggressively with products that are too harsh, or in ways that strip away your skin's natural protective elements. Your skin has a delicate balance of natural oils, beneficial bacteria, and a pH level that supports its barrier function. When you over-cleanse, you disrupt all of these, leaving your skin compromised and struggling. Think of your skin barrier like a brick wall with mortar holding it together. The bricks are your skin cells, and the mortar is made of lipids, natural oils, and fats. When you cleanse appropriately, you remove dirt and excess surface oil while leaving the structural mortar intact. When you over-cleanse, you start dissolving the mortar itself, weakening the entire wall. What does over-cleansing look like in practice? It might be cleansing your face multiple times per day. It might be using harsh, stripping cleansers, especially those with sulfates that create lots of foam. It might be using very hot water. It might be scrubbing your face aggressively or using rough washcloths, brushes, or other abrasive tools. It might be using cleansers with high pH that disrupts your skin's natural acidity. Often it's a combination of these factors. The irony of over-cleansing is that it often creates the very problems people are trying to prevent. Your skin feels oily, so you cleanse it frequently with harsh products to remove the oil. But this stripping triggers your skin to produce even more oil to compensate for what you're removing. You end up in a vicious cycle. Over-cleanse, excess oil production, over-cleanse more, even more oil production. The solution isn't more cleansing, it's better, gentler cleansing. Let's explore the signs that you might be over-cleansing. Your skin feels tight, especially immediately after cleansing. This tightness is not a sign of cleanliness, it's a sign that you've stripped too much from your skin. Healthy cleansing leaves your skin feeling clean but comfortable, never tight or pulled. Your skin has that squeaky clean feeling after washing. Again, this isn't the goal. Squeaky clean means you've removed so much natural oil that your skin literally has high friction. This is over-cleansing. Your skin becomes shiny or oily within an hour or two of cleansing, even after you've applied moisturizer. This rapid oil production is often your skin overcompensating for being stripped. You experience increased sensitivity, redness, or irritation. When you over-cleanse, you compromise your barrier, making your skin more reactive to everything: products, environment, even water. You have persistent dryness, flaking, or rough texture despite using moisturizer. No amount of moisturizer can fully compensate for a barrier that's being damaged daily by over-cleansing. You're dealing with more breakouts despite cleaning your face diligently. A compromised barrier from over-cleansing actually makes acne worse by weakening your skin's defense mechanisms and potentially spreading bacteria across your face. Your skin has become more problematic since you started cleansing more or using stronger cleansers. If your skin was better before you intensified your cleansing routine, that's a clear signal. Now let's talk about why people over-cleanse, because understanding your motivations helps you change the behavior. Many people over-cleanse because they've been taught that it's necessary. Magazine articles, product marketing, and cultural messages all reinforce the idea that thorough, frequent cleansing is essential for clear skin. This isn't true, but the message is pervasive. Some people over-cleanse in an attempt to control oily skin or acne. If you're dealing with these concerns, it's natural to think that more cleaning will help. Unfortunately, as we've discussed, it usually makes things worse. Others over-cleanse because it feels good in the moment. That tight, squeaky clean sensation can feel satisfying, like you've really accomplished something. But this temporary satisfaction causes lasting damage. Some people over-cleanse out of anxiety or a need for control. If your life feels chaotic, controlling your skincare routine, making sure your face is absolutely clean, can feel grounding. This is understandable, but there are better ways to create that sense of control without damaging your skin. Now let's explore how to stop over-cleansing and restore your skin's health. The first step is to reduce your cleansing frequency. For most people, cleansing once per day is sufficient. In the evening, to remove the day's accumulation of oil, sunscreen, makeup, and environmental pollutants. In the morning, many skin types can simply rinse with lukewarm water rather than using a cleanser. This is especially true for dry, sensitive, or mature skin. If you currently cleanse twice daily with cleanser, try switching to just a water rinse in the morning. Your skin hasn't gotten dirty overnight. There's no makeup, no sunscreen, no pollution to remove. The light layer of natural oil your skin produced overnight is actually protective and beneficial. Let it be. Only cleanse with cleanser when your skin actually needs it, after wearing makeup, sunscreen, or heavy moisturizers, or after sweating significantly. Other times, water is often enough. The second step is to choose a gentler cleanser. Put away any cleansers containing sodium lauryl sulfate, which is particularly stripping. Look for gentle pH balance cleansers. Cream cleansers, milk cleansers, or gentle gel cleansers without harsh surfactants. Your cleanser should have a pH around 5.5, matching your skin's natural pH. The cleanser should not produce a lot of foam. While foam isn't inherently bad, cleansers that create abundant, luxurious lather usually contain stronger surfactants that are more likely to strip your skin. A good gentle cleanser might produce minimal or no foam, and that's perfectly fine. Read the ingredient list. Avoid cleansers with high amounts of alcohol, fragrance at the top of the list, or anything marketed as deep cleaning, clarifying, or purifying. These often indicate harsher formulas. Look for cleansers described as gentle, hydrating, or cream-based. The third step is to adjust your cleansing technique. Use lukewarm water only, never hot. Hot water feels soothing but strips your natural oils and can damage capillaries over time. Similarly, avoid very cold water, which doesn't allow cleansers to work effectively. Apply your cleanser to damp skin and massage gently with your fingertips for about 60 seconds. This is enough time for the cleanser to work without being excessive. Use light, circular motions. Don't scrub, press hard, or pull at your skin. Pretend you're cleansing a baby's face. That's the level of gentleness appropriate for your own face. Rinse thoroughly and completely. Incomplete rinsing can leave residue that irritates skin, but excessive rinsing is also unnecessary. Splash your face repeatedly with lukewarm water until all cleanser is gone. Usually 10 to 15 splashes, then stop. Pat your face dry with a soft, clean towel. Don't rub. Rubbing creates friction and can irritate skin, especially when damp and vulnerable. The fourth step is to eliminate aggressive cleansing tools or use them much more carefully. Put away harsh facial brushes, rough washcloths, and abrasive scrubs. Your hands are the best tools for cleansing. They allow precise pressure control and don't harbor bacteria like reusable tools can. If you enjoy using tools, choose soft silicone cleansing pads used gently, or very soft washcloths used with minimal pressure. Clean any reusable tools thoroughly after each use and replace them regularly. Completely stop using physical exfoliating scrubs with rough particles. These are almost always too harsh and create micro tears in your skin. If you want exfoliation, gentle chemical exfoliants used sparingly are far safer and more effective. Now let's discuss the transition period and what to expect when you stop over-cleansing. When you first reduce cleansing frequency or switch to gentler cleansing, your skin might go through an adjustment period. If you've been over-cleansing, your oil glands have been in overdrive. When you stop stripping your skin, it takes time for oil production to normalize, usually 1 to 3 weeks. During this transition, your skin might feel slightly more oily than usual. This is temporary. Resist the urge to go back to harsh cleansing. Stay the course with gentle cleansing. Use a lightweight moisturizer and be patient. Your skin will rebalance. You might also notice some initial purging or congestion as your skin adjusts and its natural processes normalize. Again, this is temporary and should resolve within a few weeks. If it persists beyond a month, you may need to adjust something else in your routine. But the gentler cleansing itself is still correct. As your skin rebalances, you'll start noticing improvements. Less tightness and discomfort, decreased oil production as your skin no longer overcompensates, improved texture and reduced sensitivity, better response to your other skincare products because your barrier is intact, fewer breakouts as your skin can function normally, and an overall healthier appearance. Let's address specific situations and skin types. For oily or acne-prone skin, gentle cleansing is still the answer. Use a gentle gel or foam cleanser once daily in the evening. You can use a BHA treatment separately after cleansing if needed for acne, but the cleansing itself should be gentle. Morning water rinse is often sufficient. If you must cleanse in the morning, use the same gentle cleanser very briefly. For dry or sensitive skin, cleansing once daily is usually enough, and you might even reduce to every other day if your skin tolerates it. Use a cream cleanser or cleansing milk. Consider cleansing oils or balms, which cleanse while nourishing. Morning water rinse is definitely sufficient. For combination skin, one evening cleanse with a balanced, gentle cleanser usually works well. If your T-zone feels it needs morning cleansing, you can cleanse just that area with cleanser while rinsing the rest with water, but this is optional. If you wear heavy makeup or waterproof sunscreen, you might benefit from double cleansing in the evening. First with an oil-based cleanser or micellar water to dissolve makeup and sunscreen, Then with your gentle, regular cleanser. But this is still just once per day in the evening, and both cleansers should be gentle. Let's talk about exercise and sweat. After working out, you want to cleanse away sweat, but you still want to be gentle. If you exercise in the morning, that can be your one cleansing of the day. If you exercise midday, cleanse gently after, then just rinse with water that evening. Don't cleanse 3 times per day, even on workout days. Adjust the timing instead. Creating new cleansing habits takes awareness and practice. It might help to set reminders or create new mental associations. When you reach for your cleanser in the morning, pause and ask, does my skin actually need this, or would water be enough? Often, the honest answer is that water is sufficient. When you cleanse, check your water temperature by testing it on your inner wrist first. If it feels hot, it's too hot for your face. Adjust until it feels neutral, barely warm. Time your cleansing. If you're spending more than 60-90 seconds actually cleansing, you're probably overdoing it. 1 minute is enough for the cleanser to work without stripping your skin. As we come toward closing, embrace this important truth. Clean doesn't mean stripped. Healthy cleansing removes what doesn't belong: dirt, excess surface oil, makeup, sunscreen, while preserving what does belong: your skin's protective barrier, beneficial oils, natural pH, and healthy microbiome. Your skin is not inherently dirty or problematic. It's designed to maintain itself with gentle support, not aggressive intervention. When you stop over-cleansing and start cleansing appropriately, you give your skin the chance to return to its natural, healthy balance. Take a deep breath. You now understand over-cleansing and how to stop it. You know that gentle, appropriate cleansing serves your skin far better than harsh, frequent cleansing. May you cleanse with gentleness and intention. May your skin find its natural balance. May you release the need for
prevent foundation migration while reducing the need for heavy foundation application. Light powder setting rather than additional product buildup can actually improve makeup longevity while reducing acne trigger risk. Eyeshadow, eyeliner, and mascara are less likely to trigger facial acne, unless you're rubbing your eyes and transferring product to your face. However, avoid eyeshadow that falls onto your cheeks or near your cheekbones where it might clog pores. Waterproof mascara and eyeliner can be harder to remove, potentially leaving residue that accumulates and irritates skin. Ensuring thorough removal of eye products is important. Lip products can contribute to acne in the perioral area. Heavy, occlusive lipsticks might trigger breakouts around the mouth. Lighter formulations and careful removal reduce this risk. Some lip products contain irritating ingredients that, while not technically triggering acne, irritate the perioral skin, making breakout appearance worse. Makeup brushes and applicators accumulate bacteria, dust, and product residue. Dirty brushes directly transfer bacteria and irritants to skin, worsening acne. Clean makeup brushes at least weekly with gentle shampoo or brush cleaner. Replace sponges frequently. Use clean hands or clean applicators when possible rather than dirty brushes. Removal of makeup is crucial. Leaving makeup on overnight allows prolonged contact with pores, promotes bacterial growth, and worsens acne. Thoroughly remove all makeup before bed using an appropriate makeup remover or cleansing oil, followed by your regular cleanser. Double cleansing, first with oil-based remover, then water-based cleanser, is particularly effective for completely removing makeup and sebum. Mineral makeup is often better tolerated by acne-prone skin than conventional makeup. Mineral formulations use zinc oxide, titanium dioxide, and iron oxides as pigments without some of the potentially problematic ingredients in conventional cosmetics. Many mineral makeup lines specifically formulate for acne-prone skin. BB creams and CC creams offer lighter coverage than full foundation while providing some color correction. These lighter formulations are often better tolerated by acne-prone skin than traditional foundations. If you need coverage, consider whether a BB cream provides adequate coverage before resorting to heavier foundation. Tinted moisturizers combine light coverage with hydration, often with less pore clogging potential than foundations. For those with mild acne or seeking light coverage, tinted moisturizers can be a good option. Sunscreen itself should be acne-safe. Many sunscreens worsen acne due to occlusive or comedogenic formulations. Specifically choose sunscreens for acne-prone skin, labeled non-comedogenic, oil-free, or for acne-prone skin. Mineral sunscreens are often better tolerated than chemical sunscreens. Testing new products carefully is essential. Introduce one new cosmetic at a time, using it for 1 to 2 weeks to assess whether it triggers new breakouts. If breakouts appear, discontinue the product and wait for acne to resolve before trying a different product. Testing one product at a time allows you to identify which products your skin tolerates. Some people find that minimizing overall makeup use helps control acne more than finding the perfect acne-safe products. If you use makeup only when necessary rather than daily, less product contact with skin means fewer breakout triggers. Consider whether you actually need all the makeup you're using or whether you could achieve similar results with less product. Professional makeup application services for special events often use heavy product application techniques. If you need professional makeup done, inform the makeup artist about your acne and request lighter application and acne-safe products if possible. Alternatively, request that you apply your own makeup at home after a professional provides guidance. The bottom line: find acne-safe products suitable for your skin, apply minimally, remove thoroughly, and use clean tools. This approach allows you to use cosmetics without significantly exacerbating acne. Guide 30: Building your perfect personalized skincare routine, complete advanced framework. After understanding numerous acne treatments and supporting strategies, integrating all this knowledge into a personalized, optimized skincare routine that works specifically for your skin is essential. This comprehensive framework guides you through creating your perfect routine. Step 1: Identify your specific acne profile. Are you primarily comedonal, blackheads, whiteheads? Inflammatory, red pimples, pustules? Hormonal, deep cystic lesions? Severe mixed type? Fungal acne? Acne cosmetica? Your acne type guides which treatments are most appropriate. Comedonal acne particularly benefits from salicylic acid. Inflammatory acne responds best to benzoyl peroxide. Hormonal acne often requires systemic hormonal treatment. Fungal acne requires antifungal treatments. Getting your acne type right prevents wasting time on ineffective treatments. Step 2: Assess your skin type and sensitivities. Is your skin oily, dry, combination, or balanced? Very sensitive or robust? Do you have history of allergic reactions? Do you have rosacea or other reactive conditions? This information determines which products and concentrations your skin tolerates. Sensitive skin requires gentler products, lower active ingredient concentrations, and slower introduction of new treatments. Oily skin tolerates stronger treatments and higher concentrations. Dry skin requires careful moisturizing even while using drying treatments. Step 3. Evaluate contributing factors. What worsens your acne? Stress? Hormonal cycles? Certain foods? Sleep deprivation? Specific products? Environmental factors? Identifying contributing factors allows you to address root causes alongside medical treatment. If stress worsens acne, stress management becomes part of your treatment. If hormonal cycles worsen acne, tracking cycles and timing treatment adjustments helps. Step 4. Set realistic timelines and goals. Most acne improves over 8 to 12 weeks of consistent treatment. Severe acne might take 4 to 6 months or longer. Scars fade over 6 to 12 months with appropriate treatment. Setting realistic expectations prevents discouragement from expecting overnight results. Your goal might be clear skin or manageable acne with occasional breakouts, depending on your acne severity. Step 5. Design your morning routine. Start with a gentle cleanser appropriate for your skin type, used with lukewarm water. Follow with optional essences or hydrating toners if desired. Apply any morning actives, perhaps vitamin C serum for antioxidant protection. Apply your morning moisturizer. Finish with SPF 30+ sunscreen. This entire routine should take 5 to 10 minutes. Keep it simple so it's sustainable. Step 6. Design your evening routine. Start with makeup removal if applicable, oil-based cleanser or micellar water. Follow with your evening cleanser. Apply any evening hydrating toners or essences. Apply your primary acne treatment, perhaps salicylic acid or benzoyl peroxide, starting at low frequency, typically severe stress, hormonal changes, medications, require adjusting your treatment approach. Your dermatologist can help. Celebrate achieving clear skin. Reaching this point likely required significant effort and patience. Recognize the achievement and the work that got you there. This perspective helps maintain motivation for long-term maintenance. Guide 20. Integrating all components, your complete personalized acne treatment and maintenance blueprint. After understanding individual components of acne treatment, integrating them into a comprehensive, personalized blueprint is essential. No single treatment works for everyone. Your specific acne type, skin characteristics, and lifestyle factors should guide your approach. Step 1. Accurately identify your acne type. Do you have comedonal acne, blackheads and whiteheads? Inflammatory acne, red pimples? Hormonal acne, deep cystic lesions around your jawline during specific times? Severe acne involving all types? Your acne type guides treatment selection. Comedonal acne responds best to salicylic acid exfoliation. Inflammatory acne responds best to benzoyl peroxide. Hormonal acne often requires systemic hormonal treatment. Severe mixed acne usually requires combination treatments and potentially professional intervention. Step 2. Assess acne severity. Mild acne, fewer than 20 comedones, fewer than 15 inflammatory lesions, no nodulocystic lesions, often responds adequately to topical treatments alone. Moderate acne, 20 to 100 comedones, 15 to 50 inflammatory lesions, no nodulocystic lesions, typically requires combination topical treatments, possibly with professional treatments. Severe acne, extensive lesions, numerous nodulocystic lesions, usually requires systemic treatment including oral antibiotics, hormonal treatments, or potentially isotretinoin. Step 3. Consider your lifestyle factors. Are you comfortable with multiple daily skincare steps? Can you prioritize sleep and stress management? Will you maintain consistency? These practical factors determine whether complex multi-step routines are realistic for you. Some people thrive with detailed routines, others do better with simplified approaches. Step 4. Design your core routine. Everyone benefits from a consistent cleanse, treat, moisturize, protect routine. Select specific products for each step based on your acne type. For comedonal acne, use a gentle cleanser, apply salicylic acid treatment, use a non-comedogenic moisturizer, apply sunscreen. For inflammatory acne, use a gentle cleanser, apply benzoyl peroxide treatment, use a moisturizer, apply sunscreen. For mixed or severe acne, consider consulting a dermatologist for prescription treatments. Step 5. Start conservatively with treatments. Begin with a single active ingredient at low concentration, using it 2 to 3 times weekly. After 3 to 4 weeks of good tolerance, assess results. If you're seeing improvement, continue. After 8 weeks, you can increase frequency or concentration if desired. If you're not seeing improvement after 8 to 12 weeks, consider adding a second treatment, for example, adding retinoid to salicylic acid, or consulting a dermatologist. Step 6. Build treatment combinations gradually. Never start 2 new treatments simultaneously. After establishing tolerance to your first treatment, at least 4 weeks, you can introduce a second treatment on different days or in different parts of your routine. For example, use salicylic acid cleanser in the morning, retinoid at night. Start the new treatment at low frequency and concentration, building up gradually. Step 7. Incorporate lifestyle changes. Implement dietary improvements, reduce sugar, increase antioxidants, consider eliminating dairy if it worsens your acne. Prioritize sleep, 7 to 9 hours nightly. Implement stress management, meditation, yoga, exercise, or other stress reduction techniques. These changes typically take 4 to 8 weeks to show skin effects but provide significant benefits. Step 8. Implement professional treatments if appropriate. If topical treatments aren't adequately controlling your acne after 8 to 12 weeks of consistent use, or if you have moderate to severe acne, professional treatments accelerate improvement. Monthly superficial chemical peels combined with your home routine provide excellent results. Professional facials or blue light therapy offer additional options. Step 9. Adjust for your specific factors. If you're a woman with hormonal acne, discuss hormonal treatments, oral contraceptives, spironolactone, with your gynecologist or dermatologist. If you're very acne-prone, you might need slightly more aggressive treatment than someone with occasional pimples. If your skin is sensitive, you'll need to progress more gradually with treatments. Step 10. Track your progress and adjust. Keep a skincare journal noting products used, frequency, side effects, acne status, stress levels, diet, and sleep. After 8 to 12 weeks, assess results. Have you seen improvement? Are side effects manageable? Are you ready to increase treatment intensity? Are you experiencing purging or adaptation? Adjust accordingly. Step 11. Set realistic timelines. Clear skin typically requires 8 to 12 weeks with topical treatments alone, potentially faster with professional treatments. However, residual hyperpigmentation and scarring may require additional time and treatment. Setting realistic expectations prevents discouragement from expecting overnight results. Step 12. Prepare for long-term maintenance. Once clear, continue your core routine indefinitely at maintenance levels. Don't expect to stop all treatments and maintain clear skin. Your skin's acne tendency hasn't fundamentally changed. Maintenance requires ongoing treatment, though frequency may decrease significantly. A sample complete routine for moderate mixed acne. Morning, gentle cleanser vitamin C serum, antioxidant protection, optional, non-comedogenic moisturizer SPF 30+ sunscreen. Evening, gentle cleanser salicylic acid toner or treatment, 3 to 4 times weekly initially, non-comedogenic moisturizer benzoyl peroxide spot treatment on active lesions or retinoid treatment, start 2 to 3 times weekly. Supplements, omega-3 supplementation, possibly zinc supplementation if deficient. Lifestyle, 7 to 9 hours sleep nightly, 30-minute exercise 5 times weekly, stress management through meditation or yoga, diet emphasizing whole foods and reducing sugar/dairy. Professional, monthly superficial chemical peels if available and affordable. This comprehensive approach addresses acne through multiple angles simultaneously. After 8 to 12 weeks of consistent implementation, you should see significant improvement. After 6 months, most people achieve clear or nearly clear skin. After a year, you've developed habits that maintain clear skin long term. Remember, acne treatment is individual. What works perfectly for one person may not work for another. Patience, consistency, and willingness to adjust are more important than finding the perfect product. Most acne responds to consistent, appropriate treatment. It's a matter of identifying what works for your specific skin and persisting with it. You now have a complete understanding of acne pathophysiology, treatment options, professional treatments, lifestyle factors, and integration strategies. Armed with this knowledge, you can approach your acne treatment confidently, make informed decisions, and achieve and maintain clear skin. Your journey to clear skin is absolutely possible with proper treatment, professional guidance when needed, and consistent effort over time. Commit to the process, trust in evidence-based treatments, and clear skin will follow. 20 Advanced Skin Care and Acne Treatment Guides, Part 2. Each guide, 10 to 15 minutes reading time. Guide 21, Isotretinoin, Accutane, the definitive acne treatment for severe and resistant cases. Isotretinoin.
Hello, and welcome to this restful space. Take a moment to breathe deeply and settle in. Today we're going to explore something essential yet often overlooked: how what you put into your body affects the health and appearance of your skin. Your skin is your body's largest organ. It's not separate from the rest of you. It's deeply connected to your overall health, your nutrition, your hydration, and your internal well-being. While topical skincare products are valuable, they work best when supported by healthy habits from within. Let's begin with water, the foundation of life and of healthy skin. Your body is approximately 60% water. Your skin, particularly the deeper layers, contains a significant amount of water. This water is essential for every cellular process, for delivering nutrients to your skin cells, for maintaining your skin's plumpness and elasticity, and for flushing out toxins. When you're dehydrated, your skin shows it. Dehydrated skin looks dull and feels tight. Fine lines appear more prominent. Your skin may feel rough or flaky. In severe dehydration, your skin loses elasticity. When you pinch it gently, it doesn't spring back as quickly as it should. So how much water should you drink? The old 8 glasses a day rule is a reasonable guideline, but your actual needs depend on many factors: your body size, your activity level, the climate you live in, and your overall health. A more personalized approach is to pay attention to your thirst and the color of your urine. If you're thirsty, drink. If your urine is dark yellow, you need more water. Pale yellow is ideal. Drink water consistently throughout the day rather than trying to gulp down large amounts all at once. Your body can only absorb so much at a time, and steady hydration is more effective than sporadic large intakes. Start your day with a glass of water. Keep water nearby as you work or go about your activities. If you find plain water boring, add slices of lemon, cucumber, or fresh herbs for natural flavor. Herbal teas count toward your hydration as well. But here's an important nuance. Drinking water alone won't magically perfect your skin. If you're already adequately hydrated, if you're drinking when thirsty and your urine is pale yellow, drinking more and more water won't provide additional benefits. Your skin can only hold so much water, and any excess is simply eliminated. What matters is consistent, adequate hydration combined with products that help your skin retain that moisture. This is where topical hydrators like hyaluronic acid come in. They help your skin hold on to the water you're providing from within. Now let's talk about diet and skin health. This is where things become both fascinating and complex. The relationship between diet and skin is real but nuanced. No single food will transform your skin overnight, and no single food is likely ruining your skin either. What matters is your overall dietary pattern over time. Let's explore nutrients that support skin health. Omega-3 fatty acids help maintain your skin's lipid barrier, which keeps moisture in and irritants out. They also have anti-inflammatory properties that can help with conditions like acne and rosacea. You'll find omega-3s in fatty fish like salmon, mackerel, and sardines, as well as in walnuts, flax seeds, and chia seeds. Aim to include these foods regularly in your diet. Antioxidants protect your skin from free radical damage caused by sun exposure, pollution, and normal metabolism. Vitamin C and E are powerful antioxidants. Vitamin C also supports collagen production. You'll find vitamin C in citrus fruits, berries, bell peppers, and leafy greens. Vitamin E is abundant in nuts, seeds, and avocados. Vitamin A supports skin cell production and repair. You'll find it in orange and yellow vegetables like carrots, sweet potatoes, and squash, as well as in dark leafy greens. Your body converts the beta-carotene in these foods into usable vitamin A. Zinc supports skin healing and helps control oil production. It's found in oysters, beef, pumpkin seeds, and lentils. If you struggle with acne or slow wound healing, Ensuring adequate zinc intake might help. Protein provides the amino acids your body needs to produce collagen, elastin, and other structural proteins in your skin. Include adequate protein from sources like lean meats, fish, eggs, legumes, or tofu. Now let's address foods that might negatively affect your skin. The research here is less definitive and individual responses vary significantly, but certain patterns emerge. High glycemic foods, those that cause rapid spikes in blood sugar, may worsen acne for some people. This includes white bread, white rice, sugary snacks, and sweetened beverages. When blood sugar spikes, your body produces more insulin and androgens, which can increase oil production and inflammation. This doesn't mean you must eliminate all carbohydrates or sugar. It means choosing complex carbohydrates like whole grains, which release sugar more slowly, and moderating your intake of refined sugars and processed foods. Balance and moderation are key. Dairy, particularly skim milk, has been associated with acne in some studies. The hormones naturally present in milk might influence your own hormone levels and oil production. However, not everyone responds to dairy this way. If you suspect dairy affects your skin, try eliminating it for 4 to 6 weeks and observe whether your skin improves. If it does, you've identified a trigger. If it doesn't, dairy likely isn't an issue for you. Alcohol dehydrates your body and can dilate blood vessels, potentially worsening conditions like rosacea. It also taxes your liver, which plays a role in detoxification and skin health. Moderate consumption, 1 drink occasionally, is fine for most people, but excessive regular drinking can definitely impact your skin negatively. Highly processed foods often contain inflammatory oils, excessive salt, and artificial additives. While occasional consumption won't harm you, a diet dominated by processed foods doesn't provide the nutrients your skin needs and may promote inflammation throughout your body, including your skin. Here's what a skin-supportive diet looks like in practice. Plenty of colorful vegetables and fruits, adequate protein from varied sources, healthy fats from fish, nuts, seeds, and avocados, whole grains rather than refined carbohydrates, moderate amounts of dairy if you tolerate it well, limited processed foods and added sugars, and adequate water throughout the day. Notice that this is simply a generally healthy diet. There's no magic skin diet that differs dramatically from what supports your overall health. When you nourish your body well, your skin benefits along with everything else. Let's talk about supplements because many people wonder if they should take supplements for skin health. If you eat a varied, balanced diet, you probably don't need supplements specifically for your skin. However, certain deficiencies do affect skin health, and supplementation might be helpful in those cases. If you live in a northern climate, have darker skin, or spend little time outdoors, you might be deficient in vitamin D. Your doctor can test your levels. Vitamin D supports skin cell growth, repair, and metabolism. If you don't eat fish regularly, an omega-3 supplement might benefit your skin and overall health. Look for high-quality fish oil, or, if you're vegetarian, algae-based omega-3s. If you have diagnosed deficiencies in zinc, vitamin A, or other nutrients, supplementation under a doctor's guidance is appropriate. But don't take supplements speculatively or in megadoses. More isn't better, and some vitamins can be harmful in excess. Collagen supplements have become popular for skin health. The evidence is mixed. Some studies suggest they might improve skin hydration and elasticity, while others show minimal benefit. If you want to try collagen, look for hydrolyzed collagen peptides, which are more easily absorbed. But manage your expectations. Collagen supplements aren't miracle workers. Probiotics might benefit skin health indirectly by supporting gut health, which is connected to skin conditions like acne and rosacea for some people. However, the research is still emerging, and not everyone will see skin improvements from probiotics. Before taking any supplement, consider whether you might get the same nutrients from food instead. Supplements are meant to supplement a healthy diet, not replace it. And always inform your doctor about supplements you're taking, as they can interact with medications. Now let's discuss the gut-skin connection, because this is an area of growing research and understanding. Your gut microbiome, the community of bacteria and other microorganisms in your digestive system, influences your overall health, including your skin. An imbalanced gut microbiome has been linked to inflammatory skin conditions like acne, rosacea, and eczema. Supporting your gut health may support your skin health. Here's how. Eat probiotic-rich foods like yogurt, kefir, sauerkraut, kimchi, and other fermented foods. These provide beneficial bacteria. Eat prebiotic-rich foods like garlic, onions, leeks, asparagus, and bananas. Prebiotics feed the good bacteria in your gut. Eat plenty of fiber from vegetables, fruits, and whole grains. Fiber supports healthy digestion and a diverse microbiome. Limit antibiotic use to when it's truly necessary, as antibiotics kill beneficial bacteria along with harmful ones. Manage stress, which can disrupt your gut microbiome. Again, these are practices that support overall health. The connection between gut and skin is one more reason to care for your whole body, not just your skin in isolation. Let's address a common question. Can food allergies or sensitivities cause skin problems? Yes, sometimes. True food allergies can cause hives, swelling, or rashes. Food sensitivities, which are different from allergies, might manifest as chronic skin issues like eczema or acne for some people. If you suspect a food is affecting your skin, the most reliable way to investigate is an elimination diet under the guidance of a healthcare provider. You remove the suspected food completely for several weeks, then reintroduce it while carefully monitoring your symptoms. This helps you identify true triggers versus coincidental correlations. Don't eliminate entire food groups based on speculation or unproven theories. This can lead to nutritional deficiencies and an unhealthy relationship with food. If you have concerns, work with a doctor or registered dietitian. As we come toward the close of our time together, let's remember the big picture. Your skin is part of your body, not separate from it. What supports your overall health supports your skin. Hydration, nutrition, gut health, sleep, stress management, all of these affect your skin along with every other part of you. You don't need a perfect diet to have healthy skin. You don't need expensive superfoods or restrictive elimination diets. You simply need to nourish yourself consistently and adequately with real, varied, whole foods and plenty of water. When you eat a varied diet rich in vegetables, fruits, whole grains, healthy proteins, and good fats, you're providing your skin with everything it needs to be healthy. When you stay adequately hydrated, you're supporting your skin's function and appearance. When you care for your gut health, You're potentially improving your skin along with your digestion and immunity. Topical skincare products are valuable tools, but they work best when supported by nourishment from within. Think of it as a partnership. Feed your skin from the inside with good nutrition and hydration. Care for it from the outside with appropriate products. Take a deep breath in and release. You now understand how hydration and nutrition support your skin health. May you nourish yourself with wisdom and without restriction. May you hydrate adequately and consistently. May you see your skin as part of your whole body, deserving of care from within and without. Thank you for this peaceful time together. Be well, nourish yourself, and trust that your body knows how to be healthy when you provide what it needs. Welcome, and take a moment to breathe. Let yourself settle into this peaceful space where we'll explore together how to choose a moisturizer that truly serves your skin. There's no rush, no pressure, just gentle guidance as we navigate this essential aspect of skincare. Moisturizer is perhaps the most important product in your skincare routine. It doesn't matter if you have dry skin, oily skin, or anything in between. Every skin type needs and benefits from proper moisturization. Yet choosing the right moisturizer can feel overwhelming when you're faced with endless options, conflicting advice, and marketing claims that promise miracles. Let's start by understanding what moisturizer actually does and why your skin needs it. Your skin is constantly losing water through a process called transepidermal water loss. Water evaporates from the deeper layers of your skin through the outer layer and into the environment. This is a natural, unavoidable process, but when you lose too much water, your skin becomes dehydrated, compromised, and unable to function optimally. A good moisturizer does two essential things. It delivers hydration to your skin, and it helps prevent water loss by creating a protective barrier. Think of it as both giving your skin a drink and putting a lid on the glass so the water doesn't evaporate away. Now let's talk about the three main types of ingredients in moisturizers and how understanding these will help you choose the right product. First, we have humectants. Humectants are ingredients that attract water. They draw moisture from the environment and from the deeper layers of your skin to the surface. Common humectants include hyaluronic acid, glycerin, and aloe vera. These ingredients are wonderful for adding hydration, for making your skin feel plump and supple. If your skin feels tight or rough, humectants can help tremendously. Second, we have emollients. Emollients fill in the spaces between skin cells, smoothing the surface of your skin and making it soft to the touch. They help repair your skin's barrier and make your skin feel comfortable. Ingredients like ceramides, squalane, and various plant oils are emollients. If your skin feels rough or flaky, emollients will help create that smooth, soft feeling you're looking for. Third, we have occlusives. Occlusives create a physical barrier on top of your skin that prevents water from evaporating. They're like that lid we mentioned earlier, sealing in all the hydration. Ingredients like petrolatum, mineral oil, and dimethicone are occlusives. They're especially helpful if your skin is very dry or if you live in a harsh climate. The best moisturizers contain a combination of all three types of ingredients. They hydrate with humectants, smooth with emollients, and seal with occlusives. This comprehensive approach addresses all aspects of moisture maintenance. Now, how do you choose the right moisturizer for your specific skin type? Let's go through each type slowly and thoughtfully. If you have dry skin, you need a richer moisturizer with more emollients and occlusives. Look for creams rather than lotions. Creams have a higher oil content and provide more intensive moisture. Your dry skin is telling you it needs more help maintaining its barrier and holding on to water. Ingredients like shea butter, ceramides, and hyaluronic acid will be your friends. Don't be afraid of products that feel rich and substantial. Your skin needs that extra nourishment. If you have oily skin, you might think you don't need moisturizer, but you absolutely do. Oily skin can still be dehydrated. In fact, sometimes your skin produces more oil because it's trying to compensate for dehydration. Choose a lightweight, gel-based, or water-based moisturizer. These formulas provide hydration without adding excess oil. Look for non-comedogenic products that won't clog your pores. Ingredients like hyaluronic acid and niacinamide work beautifully for oily skin. If you have combination skin, oily in some areas and dry in others, you have two options. You can use one balanced moisturizer all over your face, choosing a medium weight lotion that's not too heavy and not too light. Or you can use two different moisturizers, applying a lighter one to your oily zones and a richer one to your dry areas. Listen to what your skin needs and be willing to adjust seasonally. If you have sensitive skin, simplicity is key. Choose a moisturizer with minimal ingredients and no fragrance. Fragrance is one of the most common causes of irritation and allergic reactions. Look for products labeled as hypoallergenic and designed for sensitive skin. Ingredients like colloidal oatmeal, allantoin, and Centella asiatica can be particularly soothing. When trying a new moisturizer, always patch test it first on a small area of skin to make sure it doesn't cause irritation. Let's talk about texture for a moment because the way a moisturizer feels matters tremendously. You need to enjoy using your moisturizer, or you won't use it consistently. Some people love thick, rich creams that feel nourishing and substantial. Others prefer lightweight gels that absorb quickly and leave no residue. Neither is better. It's about what works for you and what you'll actually use every day. When you're testing a moisturizer, pay attention to how it feels immediately after application, and then how your skin feels an hour later. Does it sink in nicely or does it sit on the surface? Does your skin feel comfortable and balanced, or does it feel tight, greasy, or irritated? Your skin will tell you if a product is right. Trust those signals. Consider the time of day as well. Many people benefit from using different moisturizers in the morning versus at night. Morning moisturizers are often lighter because you'll be applying makeup or sunscreen over them. Night moisturizers can be richer and more intensive because your skin does most of its repair work while you sleep, and you don't need to worry about makeup application. Speaking of sunscreen, if your moisturizer contains SPF, that's wonderful for morning use. But remember that you need to apply enough to get the stated protection, about a quarter teaspoon for your face. Many people don't apply enough moisturizer to achieve adequate sun protection. So you might consider using a separate sunscreen to ensure you're fully protected. Let's address price for a moment. Expensive doesn't always mean better. Some of the most effective moisturizers are quite affordable. What matters is the ingredient list and how the product works for your specific skin. Don't feel pressured to spend a fortune. A drugstore moisturizer with good ingredients can work just as well as a luxury product. However, if a higher-end product brings you joy, if applying it feels like a special ritual that you look forward to, and if it works well for your skin, then it's worth the investment. Skincare should feel good. It should be something you enjoy, not endure. When reading ingredient lists, remember that ingredients are listed in descending order by concentration. The first 5 to 7 ingredients make up the bulk of the formula. This is where you want to see your key moisturizing ingredients, your humectants, emollients, and occlusives. Be cautious of products that list water as the first ingredient, followed by many fillers before you get to any beneficial ingredients. While water is a necessary base for most moisturizers, you want to see nourishing ingredients high up on that list. One more consideration: seasonal changes. Your skin's needs vary with the weather and climate. You might need a lighter moisturizer in humid summer months and a richer one in dry winter weather. This doesn't mean you need to buy multiple products at once. Start with one good moisturizer for your current season and adjust as needed when the weather changes. How do you apply moisturizer for maximum benefit? Always apply it to damp skin. After cleansing, gently pat your face with a towel, leaving it slightly damp, then immediately apply your moisturizer. This helps lock in that extra water and makes your moisturizer more effective. The humectants in your moisturizer will draw that water deeper into your skin. Use gentle upward strokes when applying. Take your time. Use this as a moment of self-massage and care. Press the product gently into your skin rather than rubbing vigorously. Be especially gentle around your delicate eye area. Don't forget your neck and décolletage. The skin there is just as deserving of moisture and care as your face. Many people focus solely on their face and then wonder why their neck shows signs of aging. Extend your moisturizer down your neck in upward strokes. What if you try a moisturizer and it doesn't work for you? That's okay. Skincare is personal, and what works wonderfully for someone else might not work for you. Don't feel discouraged. Simply make note of what you didn't like about it and use that information to guide your next choice. Was it too heavy? Too light? Did it cause any irritation? Each product teaches you more about what your skin needs. As we come to the close of our time together, remember these key points. Every skin type needs moisturizer. Choose based on your skin type and personal preferences. Look for products with humectants, emollients, and occlusives. Apply to damp skin for best results. Be willing to adjust seasonally. And most importantly, choose a moisturizer you actually enjoy using. Your moisturizer is your skin's daily drink of water, its protective barrier against the environment, its nourishment and support. Choose thoughtfully, but don't overthink it. Your perfect moisturizer is out there, and you'll know it when you find it because your skin will feel comfortable, balanced, and cared for. Take a deep breath in and release. You now have the knowledge you need to choose a moisturizer that serves your skin beautifully. May your skin feel hydrated, comfortable, and healthy. May you find joy in caring for it. Thank you for this peaceful time together. Be well and be gentle.
Critically affected by anabolic steroids, which cause severe acne, through testosterone suppression effects, though acne treatment itself doesn't affect male fertility. Untreated severe acne might indirectly affect fertility through mental health impacts and reduced relationship satisfaction. Treating acne supports fertility planning outcomes. Guide 96. acne and alcohol use, interactions and effects. Alcohol affects acne through multiple mechanisms. Understanding these relationships helps you make informed alcohol decisions. Alcohol increases inflammation and dehydration, both worsening acne. Excessive alcohol consumption notably worsens acne in most people. Alcohol consumption patterns matter. Occasional moderate alcohol probably has minimal skin effects. Chronic excessive consumption significantly worsens acne. Some acne medications interact with alcohol. Isotretinoin with alcohol increases liver toxicity risk. Antibiotics with alcohol sometimes cause nausea and reduced effectiveness. Alcohol increases cortisol and stress, indirectly worsening acne through hormonal pathways. Alcohol disrupts sleep quality, indirectly worsening acne through sleep deprivation effects. Dehydration from alcohol increases skin dehydration, contributing to compensatory sebum production and acne. For optimal acne management, minimizing alcohol consumption is beneficial. This doesn't require complete abstinence for most people, but reducing consumption supports acne improvement. Guide 97, Acne and Smoking, Direct and Indirect Effects on Skin. Smoking worsens acne through multiple mechanisms, making smoking cessation valuable for acne improvement. Smoking increases inflammation systemically, promoting acne. Smokers have higher acne prevalence than non-smokers. Smoking impairs immune function, reducing your body's ability to fight acne-causing bacteria. Smoking impairs wound healing, increasing scarring risk from acne lesions. Smoking damages skin barrier function, increasing irritation and acne risk. Secondhand smoke exposure, while less harmful than direct smoking, also worsens acne through similar mechanisms. Smoking interferes with many acne medications. Some medications have reduced effectiveness in smokers. Smoking accelerates skin aging, creating double damage, worse acne plus premature aging. Smoking cessation, beyond its general health benefits, often improves acne significantly. Many former smokers notice acne improvement within weeks to months of quitting. For optimal acne management, smoking cessation is highly beneficial if applicable. Conclusion: your acne treatment journey. Congratulations on completing this comprehensive 100-guide exploration of acne science, treatment, and management. You now possess extensive knowledge spanning from basic acne biology through emerging treatments and personalized optimization strategies. Remember these core principles as you move forward. 1. Acne is treatable. Whatever your acne severity, treatment exists. You can achieve clear skin. 2. Consistency matters more than perfection. Maintaining a routine 90% of the time beats perfect adherence for 2 months than abandonment. 3. Your acne is unique. Treatments that work for others might not work for you, and vice versa. Personalizing based on your response is important. 4. Professional help is valuable. Dermatologists can identify problems you might miss, recommend optimal treatments, and provide professional therapies beyond home care. 5. Mental health is legitimate. Acne's psychological impact is real. Addressing it matters as much as treating physical acne. 6. Lifestyle factors matter. Sleep, stress, diet, and exercise significantly affect acne. Optimizing these supports treatment success. 7. Early intervention prevents complications. Treating acne promptly prevents severe acne and scarring that would result from delayed treatment. 8. Long-term maintenance matters. Achieving clear skin isn't the finish line. Maintaining clarity requires ongoing appropriate management. Your acne journey is unique to you. Some people achieve clear skin with simple topical treatments. Others require comprehensive professional management, including systemic medications. Both paths lead to clear skin. Whether you're just starting acne treatment, struggling with treatment-resistant acne, or maintaining achieved clarity, you now have comprehensive knowledge to guide your path forward. Clear skin is achievable. Your dedication to understanding your acne and implementing appropriate treatment will lead you there. Best wishes on your acne-free future, potentially safe during pregnancy. Topical salicylic acid used in small amounts and limited areas. Large-scale systemic absorption possible though typically minimal. Topical azelaic acid, generally considered safe. Topical clindamycin. Some dermatologists recommend avoiding though others consider it relatively safe. Sulfur-based products, considered relatively safe historically. Most conservative approach during pregnancy, gentle cleansing only, avoiding all active acne treatments unless absolutely necessary. Many dermatologists recommend waiting to treat acne aggressively until after pregnancy or after breastfeeding concludes if planning to breastfeed. If acne must be treated during pregnancy due to severity or psychological impact, consultation with both your obstetrician and dermatologist ensures treatments are appropriately selected based on risk-benefit analysis specific to your pregnancy. Sometimes treating severe acne is justified despite medication risks if the psychological impact is severe. Post-pregnancy acne sometimes occurs as hormones shift after delivery. Many women tolerate this temporary worsening with the knowledge it typically resolves within months. Breastfeeding considerations. Most topical acne treatments are safe during breastfeeding as systemic absorption is minimal. However, discussing specific medications with your healthcare provider ensures safety. Postpartum hormonal changes sometimes improve acne that was severe during pregnancy. This improvement can be psychologically significant after months of acne during pregnancy. Planning for pregnancy. If you're on acne medications like isotretinoin requires stopping several months before conception. Discuss with your dermatologist if planning pregnancy. Guide 67, Acne in Adolescence, Age-Specific Management and Developmental Considerations. Adolescent acne requires understanding both the physiological changes driving acne and the psychological sensitivities of adolescence. Age-appropriate management optimizes outcomes and builds healthy skin habits for adulthood. Puberty triggers the hormonal changes driving typical adolescent acne. Androgens surge during puberty. Menopausal acne related to estrogen decline often requires hormonal approaches, hormone replacement therapy or other hormonal management, rather than relying solely on topical treatments. Dryness is more common with age and often worsens with acne treatments. Aggressive moisturizing becomes increasingly important with age. Combining anti-aging skincare with acne treatment becomes relevant in older adults. Using retinoids addresses both acne and aging simultaneously, though barrier support becomes more important. Sun damage accumulated over decades makes older adults more susceptible to post-inflammatory hyperpigmentation and other post-acne complications. Extra sun protection is crucial. Taking medications for various age-related conditions, blood pressure medications, cholesterol medications, etc., increases medication-acne interaction risks. Discussing acne treatments with healthcare providers familiar with your complete medication list is important. Guide 69, Acne Severity Scoring and Objective Progress Measurement. Objectively measuring acne severity and progress helps distinguish real improvement from perceived improvement and guides treatment adjustments. Several acne severity scoring systems exist. The Global Acne Grading System, GAGS, assesses lesion counts and types in different facial regions, providing an objective severity score. The Investigator Global Assessment, IGA, uses clinical judgment to rate severity on a scale. Various others exist with different approaches. Lesion counting helps objectively track progress. Counting comedones, blackheads and whiteheads, inflammatory papules, and pustules weekly or monthly provides objective data showing whether acne is improving. Photography provides visual documentation of progress. Taking consistent photos, same lighting, same angle, same time of day, monthly allows comparison showing improvement that might not feel obvious during the journey. Apps and digital tools can help track lesion counts, take comparison photos, and document progress over time. Severity scoring helps determine whether treatments are working and justify continuing them. If you're using a treatment and lesion counts aren't decreasing after 8 to 12 weeks, this objective data helps justify trying different treatments rather than continuing ineffective approaches. Baseline severity assessment establishes starting point for treatment. Knowing whether you started with mild, moderate, or severe acne contextualizes improvement. Someone improving from severe to moderate acne shows real progress even if not completely clear. Long-term tracking shows patterns, whether acne is generally improving, stable, or worsening over months. This helps distinguish temporary fluctuations from trends. Showing objective improvement to healthcare providers demonstrates treatment effectiveness and justifies continuing treatments or pursuing additional interventions. Guide 70, Acne and Physical Activity, Exercise Benefits and Sweat Management. While exercise's acne-triggering potential through sweating is often emphasized, the overall benefits of exercise for acne typically outweigh risks. Understanding how to exercise safely while managing sweat-related acne allows enjoying exercise benefits without acne worsening. Exercise benefits acne through multiple mechanisms: stress reduction, stress hormones worsen acne, improved sleep, critical for skin health, improved circulation, nutrient delivery to skin, hormonal regulation, particularly in women, and improved overall health. These benefits typically outweigh acne risk from sweat. Sweat itself doesn't cause acne. Bacteria combining with sweat, sebum, and dead skin cells in clogged pores causes acne. Managing sweat through hygiene and clothing prevents sweat-related acne. Sweating during exercise increases bacteria and creates moist environment promoting bacterial growth. However, showering within 1 to 2 hours after exercise removes sweat and bacteria before significant growth occurs. Wearing breathable, moisture-wicking clothing reduces sweat accumulation and bacterial growth compared to cotton or tight, non-breathable clothing. Avoiding touching your face during exercise prevents transferring sweat and bacteria to your face and spreading existing bacteria from your hands. Sports bras and tight athletic tops can cause friction and occlusion-related acne in those areas. Ensuring equipment is clean and fits properly reduces friction acne risk. Increasing hydration during exercise supports overall health and skin health. Well-hydrated skin functions better than dehydrated skin. Post-exercise cleansing is crucial. Showering or at least cleansing your face and areas covered by equipment prevents sweat and bacteria from sitting on skin for extended periods. The net effect of regular exercise is almost always positive for acne despite sweat concerns. The stress reduction, sleep improvement, and hormonal benefits typically outweigh sweat-related acne risks. Don't avoid exercise due to acne concerns. Instead, manage post-exercise hygiene properly. Guide 71. Adapting acne treatment for different body locations. Acne appearing on different body areas often requires treatment adaptation due to different skin characteristics and environmental factors across body regions. Facial acne, forehead, cheeks, nose, chin, is most common and receives most treatment attention. Facial skin typically tolerates stronger treatments better than body skin. Back acne, acne on chest and upper back, is common in males and can be severe. Body skin is thicker than facial skin and often tolerates stronger treatments. Back acne often involves larger lesions and deeper inflammation. Shoulder acne results from friction, bra straps, sweat accumulation, and clothing occlusion. Treatment combines friction reduction, sweat management, and topical treatments. Buttock acne results from friction from sitting, tight clothing, and occlusion. Prevention focuses on wearing loose, breathable clothing and good hygiene. Topical treatments similar to face can be used. Armpit/axilla acne results from sweat accumulation, friction from deodorants and antiperspirants, and occlusion. Gentle hygiene and avoiding irritating products help. Neck acne requires careful treatment as neck skin is thin and sensitive. Gentle treatments appropriate for sensitive facial skin are often better tolerated than stronger treatments. Scalp acne, acne on hairline and scalp, involves hair follicles and is often fungal or bacterial. Antifungal or antibacterial scalp treatments help. Keeping scalp clean, using clean hair products, and avoiding overly oily scalp conditions helps. General principle: treat body acne similarly to facial acne but account for thicker skin on body, can often tolerate stronger treatments, and friction/occlusion factors. Hygiene is even more important for body acne due to sweat and clothing occlusion. Guide 72. Acne treatment and athletic performance. Does acne treatment affect athletics? Some athletes worry that acne treatments affect athletic performance. Understanding whether treatments impact performance helps athletes make informed treatment decisions. Benzoyl peroxide and salicylic acid don't directly affect athletic performance. These topical treatments have minimal systemic absorption. Oral antibiotics don't significantly affect athletic performance at prescribed doses. Athletes can safely use oral antibiotics for acne without worrying about performance impacts. Spironolactone, if used by female athletes, is not banned in professional sports and doesn't directly affect performance, though it's a diuretic potentially affecting hydration. Athletes using spironolactone should ensure adequate electrolyte and fluid intake. Isotretinoin doesn't affect athletic performance. However, during isotretinoin treatment, skin is photosensitive and sometimes irritated, which might temporarily affect comfort during training. Otherwise, no performance impact. Retinoids don't directly affect athletic performance. Some concerns about sun-sensitizing acne treatments affecting outdoor athletes are legitimate. Sun-sensitizing treatments require extra sun protection for outdoor athletes. Using high SPF sunscreen that's sweat-resistant and reapplying frequently is necessary. Anxiety about acne potentially affecting performance is psychological rather than physiological. If acne causes confidence loss that affects athletic performance, treating acne improves performance through psychological mechanisms. Conversely, improved mental health from treating acne often improves athletic performance. The overall effect of treating acne in athletes is typically positive. Improved mental health, confidence, and well-being generally improve or maintain athletic performance. Guide 73, Acne Treatment Costs, Insurance Coverage, and Affordable Options. Cost of acne treatment varies dramatically based on treatments selected and whether insurance covers them. Understanding costs and coverage options helps make affordable choices. Over-the-counter topical treatments, salicylic acid, benzoyl peroxide, retinol,